Right now, as you're watching this video, there are millions of people walking around with a serious, life-altering disease, and they have absolutely no idea, no obvious symptoms, no dramatic warning, just their daily lives, completely unaware that something dangerous is quietly happening inside their body. And here's what makes this so heartbreaking. For many of them, the signs were there all along, hidden in plain sight, literally right beneath their feet. Today we are going to talk about something that most people overlook, ignore, or simply don't know about. We're going to talk about what your feet are trying to tell you, because your feet, those two things you barely think about unless they hurt, are actually one of the most powerful early warning systems your body has when it comes to diabetes. And the 9 signs we are covering today could genuinely save your life, or the life of someone you love. So please do not scroll past this. Do not click away. Because what you learn in the next few minutes might be the most important health information you've come across all year. Let's start with something that sets the stage for everything else we're going to discuss. Diabetes, specifically type 2. Diabetes is often called a silent disease, and that nickname is earned. It can live inside your body for years, sometimes an entire decade, before you feel what most people would describe as sick. During that entire time, elevated blood sugar is quietly damaging your blood vessels, your nerves, and your organs. And because the nerves and blood vessels that supply your feet are some of the longest and most vulnerable in your entire body, the feet are almost always the first place where the damage shows up. Think about that for a second. Your feet can begin showing signs of diabetes before your doctor even catches it on a standard blood test. This is why doctors, endocrinologists, podiatrists, primary care physicians all say the same thing. Look at your feet. Look at them regularly. Look at them carefully, because they will speak to you long before your body sends you to the emergency room. Now, before we go through the 9 warning signs, I want to make one thing very clear. None of these signs alone is a guaranteed diagnosis. Only a proper medical evaluation and blood tests can confirm diabetes. But what these signs can do is alert you, give you the urgency to go get checked. And that urgency, that decision to walk into a doctor's office and say, something doesn't feel right, could be the decision that changes everything for you. All right, let's get into it. The first warning sign is numbness or tingling in your feet. And I need you to really pay attention to this one, because it is the most commonly dismissed symptom on this entire list. People feel a pins and needles sensation in their feet and they think, oh, I was sitting in a weird position, or my shoe is too tight, and they move on. But when that tingling happens regularly, not just occasionally after sitting cross-legged, but consistently, randomly, even when you're lying in bed at night, that is your nervous system trying to get your attention. What's happening at the biological level is something called diabetic peripheral neuropathy. High blood sugar, over time, damages the myelin sheath, the protective coating around your nerve fibers. When that sheath is compromised, the signals your nerves send get distorted. The result? Tingling, buzzing, numbness. That strange feeling like your foot is asleep, even when it shouldn't be. This type of nerve damage typically starts in the toes and the balls of the feet, and it gradually moves upward. It's often worse at night, which is a big clue that it's not just a positional issue. If you have been experiencing persistent tingling or numbness in your feet, especially if it comes and goes, or if one foot feels different from the other, please do not wait. That is your body asking for help. The second warning sign is burning pain in the feet, particularly at night. This one is a little different from the tingling we just talked about, and it's important to understand the difference. While tingling often feels passive, like a background buzz, burning pain is active, sharp, and deeply uncomfortable. People describe it as feeling like their feet are on fire, or like they're walking on hot sand, or like there's an intense heat radiating from inside the foot, even when the skin feels normal to the touch. This burning sensation is also a result of nerve damage, but in this case, the nerves aren't just sending weak or distorted signals, they're misfiring completely. They're telling your brain that there's pain when there's actually no external cause for it. And because the nervous system tends to calm down when you're active and ramp up when you're at rest, this burning often intensifies when you lie down to sleep. Patients describe nights of lying awake with their feet throbbing, unable to find a comfortable position, putting their feet up against a cool wall for relief. If that sounds familiar, if nighttime foot burning has become part of your routine and you've been ignoring it, this is a red flag that needs medical attention right away. The third warning sign is loss of sensation, or what doctors call reduced sensitivity in the feet. This is perhaps the most dangerous sign on this list, and here's why. When most warning signs occur, they are painful or uncomfortable. They demand your attention. But loss of sensation is the opposite. It's the absence of feeling. And when you lose the ability to feel pain in your feet, you also lose your body's most fundamental protection system. Here's how dangerous this really is. A person with reduced foot sensitivity might step on a sharp object, a nail, a piece of glass, a small stone, and not feel it. They might develop a blister from an ill-fitting shoe and not notice. They might accidentally spill hot water on their foot and not realize the severity of the burn until the damage is already done. Because these injuries go unnoticed, they go untreated. And in a person with diabetes, whose circulation is already compromised, a small wound that doesn't heal properly can become infected within days. This is the pathway to diabetic foot ulcers. And diabetic foot ulcers, when they become infected deeply enough, can lead to a condition so serious that amputation becomes the only option to save the patient's life. Every 30 seconds, somewhere in the world, a lower limb is lost to diabetes. A large proportion of those cases start with exactly what we're describing right now. A wound that wasn't felt, that wasn't treated, that was allowed to worsen silently. To check your own sensitivity, here's a simple home test. Take a thin object, a toothpick works well, and very gently touch different parts of your foot, including the toes, the ball, the heel, and the arch. Close your eyes and see if you can feel it consistently. If there are areas where sensation is clearly reduced compared to the rest of your foot, or compared to your hand when you touch the same object, that's worth discussing with a doctor immediately. The fourth warning sign is slow healing wounds or sores on the feet. We just touched on this, but it deserves its own full discussion because it is one of the clearest red flags that diabetes is already significantly affecting your body. In a healthy person, the skin has an extraordinary ability to repair itself. A small cut might heal within a week, a scrape, a few days, a blister, even faster. But in a person with uncontrolled or undiagnosed diabetes, that healing process is dramatically slowed. This happens for two interconnected reasons. First, high blood sugar impairs the function of white blood cells, the soldiers of your immune system, making them slower and less effective at fighting infection and repairing damaged tissue. Second, diabetes damages the small blood vessels that deliver oxygen and nutrients to the skin. Without adequate blood flow, the cells responsible for tissue repair simply don't have the resources they need to do their job. So if you have a sore, a cut, or a wound on your foot that has been there for more than 2 weeks without significant improvement, that is not normal. That is a warning sign. If it's been there for a month or longer, that is urgent. Please do not try to treat this at home and hope it goes away. A wound on a diabetic foot that becomes infected can deteriorate extremely quickly, and what starts as a minor sore can become a deep, bone-level infection within days if the right conditions are present. The fifth warning sign is changes in skin color on the feet and lower legs. Your skin tells a story, and the skin of your feet and ankles is particularly good at revealing what's happening in your circulatory system. When blood flow to the feet is compromised, which happens in diabetes due to damage to the arteries, the skin begins to reflect that poor circulation in very visible ways. You might notice that your feet or lower legs have taken on a reddish, purplish, or bluish tint, particularly when your legs are hanging down, or you've been standing for a while. This discoloration is often called dependent rubor, and it happens because the small blood vessels in the feet dilate in a desperate attempt to compensate for poor overall circulation. Some people notice their feet become very pale or even white when elevated, and then flush red when lowered. This dramatic color change is a significant vascular warning sign. There's also a condition called diabetic dermopathy, which causes light brown, scaly patches, often described as looking like age spots, to appear on the shins. These patches are actually caused by changes in the small blood vessels and are one of the most common skin manifestations of diabetes. They're often mistaken for simple sun damage or aging, but they can appear in people in their 30s and 40s when caused by underlying diabetes. If you're looking at your feet and lower legs and noticing unusual or persistent discoloration that isn't explained by bruising or sun exposure, add this to the list of reasons to speak with your doctor. The sixth warning sign is swelling in the feet and ankles. This one requires some careful interpretation because swelling in the feet can have many causes, standing for long periods, pregnancy, certain medications, heart or kidney issues. But when swelling is persistent, when it's present when you wake up in the morning, when it seems to be getting worse over time, and especially when it's accompanied by any of the other signs we've discussed, it becomes a much more concerning picture. In the context of diabetes, foot and ankle swelling most commonly points to one of two things. First, it can be a sign of diabetic kidney disease, a condition where the kidneys begin to lose their ability to properly filter fluid from the body, leading to fluid retention in the tissues, especially in the lower extremities. Second, it can reflect poor venous circulation, where the damaged blood vessels in the legs are no longer efficiently returning blood to the heart, causing it to pool and create that characteristic puffiness around the ankles and feet. Some people dismiss foot swelling as simply something that happens as you get older. And while it's true that some degree of ankle swelling becomes more common with age, significant persistent swelling is never something to simply accept as a normal part of life without investigation. Press your finger into the swollen area for a few seconds and then release. If the indentation remains, if your skin holds the shape of your finger, that is called pitting edema, and it's a sign that the swelling is significant enough to warrant a medical evaluation. The seventh warning sign is foot cramps and muscle spasms, particularly at night. Many people experience occasional leg or foot cramps, those sharp, involuntary muscle contractions that wake you up in the middle of the night and leave you frantically stretching your calf. While these can happen to anyone, frequent or severe cramping in the feet and legs, especially at night, can be a meaningful warning sign of underlying diabetes. The connection runs through two pathways. The first is circulation. When the arteries supplying blood to the leg muscles are narrowed or damaged by diabetes, the muscles don't receive adequate oxygen during periods of rest, and they begin to cramp as a result. The second pathway is electrolyte imbalance. High blood sugar causes the kidneys to work overtime, excreting excess glucose in the urine, and in doing so, they also flush out important minerals like magnesium and potassium, both of which are essential for proper muscle function. When these minerals are depleted, cramps become more frequent and more severe. There's also a condition called peripheral artery disease that is extremely common in diabetics, where the arteries in the legs become hardened and narrowed, significantly reducing blood flow. One of the hallmark symptoms of peripheral artery disease is cramping and pain in the calves, feet, and thighs during activity, a condition called claudication, which eases with rest. If you find that walking a certain distance consistently brings on cramping in your lower legs that goes away when you stop, and this pattern repeats itself reliably, that is a symptom pattern that needs to be evaluated by a doctor without delay. The eighth warning sign is dry, cracked skin and thickened toenails. Now, I know what some of you might be thinking. Dry feet? Cracked heels? That's just a cosmetic issue. And for many people it is. But in the context of diabetes, persistent severe skin dryness on the feet carries a very different significance. High blood sugar levels affect the autonomic nerves, the nerves that control involuntary body functions, including the sweat glands in your feet. When these nerves are damaged, the sweat glands in the feet stop working properly. The result is feet that are chronically dry, that can't regulate moisture naturally, and that develop thick, hard skin, particularly on the heels, that eventually cracks. These cracks are not just uncomfortable, they are entry points for bacteria and fungi. They are the starting point of infections in feet that are already vulnerable due to poor circulation and reduced immunity. The toenails tell a similar story. In people with diabetes, the nails often become thicker, more brittle, discolored, sometimes yellow or brown, and more prone to fungal infections. Fungal nail infections, called onychomycosis, are significantly more common in diabetics, and they can be stubborn and difficult to treat. More importantly, a neglected toenail infection in a diabetic patient can spread to the surrounding skin and deeper tissues, becoming a serious problem far more quickly than it would in someone without diabetes. If your heels are deeply cracked and you've tried every cream and lotion without success, And if your toenails have become thick, brittle, or discolored and aren't responding to treatment, don't just keep buying more foot cream. Ask your doctor to check your blood sugar. The ninth and final warning sign is hair loss on the toes and feet. This one catches almost everyone by surprise. Most of us don't spend much time noticing whether our toes have hair, but this detail, the presence or absence of fine hair on the toes and lower legs, is actually something that vascular specialists and podiatrists look at very specifically when they're assessing a patient for circulatory problems. Here's the biology. Hair follicles are living structures. Like all living tissue, they require a consistent supply of oxygenated blood to survive and function. When blood flow to the extremities is significantly reduced, as it is in diabetic vascular disease, the hair follicles in those areas begin to shut down. The hair they produce becomes finer, sparser, and eventually stops growing entirely. The skin in the affected areas can also begin to look shiny or tight, another sign that the underlying tissue is under stress from inadequate circulation. If you look at your feet and toes and notice that you used to have hair there and now you don't, or if one foot has noticeably less hair than the other, this asymmetry is clinically meaningful. It's a sign that blood flow may be compromised in that limb, and it's something that should be discussed with a healthcare provider right away. Now I want to step back from the individual signs for a moment and talk about the bigger picture, because knowing the signs is one thing. Understanding what they collectively mean and what's at stake if you ignore them is something else entirely. Globally, over 537 million adults are living with diabetes. Of those, a staggering 240 million are nearly half bereft are undiagnosed. They are going about their daily lives, making dinner, going to work, tucking their kids into bed, completely unaware of what's happening inside their bodies. Many of them have already started developing complications. Many of them will experience a serious health crisis, a heart attack, a stroke, kidney failure, loss of a limb. That could have been prevented if they had only been diagnosed earlier. And here's what makes this especially tragic. Type 2. Diabetes, particularly when caught early, is one of the most manageable chronic conditions in medicine. With the right interventions, dietary changes, increased physical activity, appropriate medical treatment, the progression of the disease can be slowed dramatically. Some people, especially those in the earlier stages, are able to bring their blood sugar back to normal levels and sustain that through lifestyle change alone. The window of opportunity is real, but it closes over time. Every year that passes without a diagnosis is a year of damage accumulating. Damage to nerves, to blood vessels, to the heart, to the kidneys, to the eyes. So, the question you need to ask yourself right now is this: when did you last have your blood sugar checked? If it's been more than a year, and particularly if any of the signs we've discussed today sound familiar to you, please make an appointment. A simple fasting blood glucose test or an HbA1c test, both routine, both affordable, can give you answers that could change the entire trajectory of your health. And if you're watching this video and thinking about someone else, a parent, a sibling, a friend, a spouse who fits the description we've been discussing today, please share this video with them. Don't be subtle about it. Don't hint. Be direct. Say, I need you to watch this and I need you to see a doctor. Because sometimes the most loving thing we can do for another person is refuse to look away from a problem that they're not ready to face themselves. Now, let's talk about what you should actually do, practically right now, to protect yourself. First, make foot inspection a daily habit. Every single day, ideally after a bath or shower, when the skin is visible and clean, look at every part of your feet. Look between the toes. Look at the heels. Look at the nails. You're looking for cuts, sores, blisters, redness, swelling, any color changes, any signs of infection. Get a small mirror if you can't easily see the bottoms of your feet. If your vision makes this difficult, ask someone you trust to help you. This 5-minute daily habit has been proven to catch problems early and prevent the escalation to serious complications. Second, take footwear seriously. Never walk barefoot, especially on hard or rough surfaces. Wear well-fitting shoes that don't rub or pinch. Check inside your shoes before putting them on every time. A small pebble or folded seam that you can't feel could cause a sore in minutes. Wear clean, dry, moisture-wicking socks. Avoid socks with tight elastic bands that cut off circulation at the ankle. Third, manage your risk factors proactively. If you are overweight, particularly if you carry excess weight around the midsection, that is one of the strongest modifiable risk factors for type 2 diabetes. If you are sedentary, that compounds the risk significantly. If you have a family history of diabetes, or if you belong to a high-risk ethnic group, including South Asian, African, Hispanic, and Middle Eastern populations, your baseline risk is already elevated and screening should be happening regularly. If you smoke, quitting is one of the single most powerful things you can do for your vascular health. Smoking dramatically accelerates the arterial damage that makes diabetic complications so severe. Fourth, understand your numbers. Knowing your fasting blood glucose and your HbA1c isn't just for people who already have diabetes. These numbers tell you where you are on the spectrum: normal, pre-diabetic, or diabetic. If you're in the pre-diabetes range, and roughly 96 million Americans alone are estimated to be in that range, you have an extraordinary opportunity. Prediabetes is reversible. It is a warning that your body is giving you time to act before the situation progresses. People who make meaningful lifestyle changes at the prediabetes stage reduce their risk of developing full type 2 diabetes by up to 58%. That is a remarkable statistic. That is your body giving you a second chance. Fifth, if you are already diagnosed with diabetes, please prioritize your foot care as if your life depends on it. Because in a very real sense, it does. See a podiatrist at least once a year for a comprehensive foot exam. Never trim your own toenails aggressively or attempt to treat calluses or corns with over-the-counter chemical treatments. Keep your blood sugar as controlled as possible, because every percentage point reduction in your HbA1c reduces your risk of neuropathy and vascular complications significantly. And if you notice anything unusual on your feet, anything at all, call your doctor that day. Not tomorrow, not next week, that day. I want to close by saying something that goes beyond the medical facts. There is a tendency, especially when it comes to chronic health conditions, to feel overwhelmed, to hear information like this and feel a kind of helplessness, a sense that the body is betraying you and there's nothing you can do. I want to push back against that feeling as strongly as I can. Your body is not your enemy. These warning signs are not attacks. They are communications. Your body is extraordinarily sophisticated, and it does everything in its power to alert you to danger long before that danger becomes irreversible. The tingling in your feet, the sore that won't heal, the burning at night, the skin that's changed color. These are not random. They are messages, and they deserve to be heard. The act of watching a video like this one, of being curious enough, or concerned enough, or caring enough about your health to seek out this kind of information, that is already a form of self-advocacy. And self-advocacy in the context of health saves lives. So here is your action plan as you close this video. Look at your feet today. Actually look at them. Check for any of the 9 signs we discussed. If you find anything, write it down. Then book a doctor's appointment and bring those notes with you. Ask specifically for a blood sugar test if you haven't had one recently. And share this video with your family, in your community, with anyone who you think might benefit from hearing this. Because the truth is, diabetes doesn't have to take people by surprise. We have the knowledge, we have the tools, we have the early warning signs written right there on the bottoms of our feet, waiting to be read. All we have to do is pay attention. Your health is worth your attention. Your feet are trying to tell you something. Please listen.